In this morning's Women's Doctor, gastroparesis. It's a mysterious stomach disorder that's on the rise in teenage girls and women in their 20s. The most common symptoms are nausea, vomiting, abdominal pain, feeling full, and bloating. And Mercy Medical Center Dr. Brian Curtin is joining us now with some more information. Doctor, why does this affect young girls so much?
So that's a very good question. We do see gastroparesis in probably about, I would say, 80% women, 20% men. Definitely see it more in younger women. It's associated with, historically some conditions like diabetes and surgical injury, but more and more nowadays we're seeing it, especially after certain types of viral infections, including COVID-19.
That is very interesting that you brought that up. So why do you think there's a connection?
We've always seen in some people, especially young women, a manifestation of certain types of GI syndromes like irritable bowel syndrome and gastroparesis after viral illnesses. And so it makes sense, when we hear about the COVID-19 long haulers that have, persistent symptoms after the initial infection, that it would affect the GI tract as well. And we do see a manifestation of gastroparesis in some select patients.
So if someone's having symptoms like this, what are some of the steps that they should take? Diagnostically, what do you do?
So diagnosis is always very difficult just because the symptoms can be somewhat nonspecific. As you mentioned, the bloating and nausea, abdominal pain, which can be caused by a number of things. So it's really important to talk to your doctor about getting an appropriate gastric emptying study, which actually measures the transit time of the stomach as it empties. Generally, the stomach should be almost completely empty within 4 hours of time, and that's how we make the diagnosis of gastroparesis.
And so that's something, is that the test where you eat something and has like a dye in it and you take frequent pictures to see where that food is traveling?
Exactly. So it's usually like a pretty bland meal, like egg whites or something similar, and it's labeled with a radio tracer. So when you take the test, it will measure at 1 hour, 2 hours, and 4 hours how much of that standardized meal is left in your stomach. And if there is more than 10% of that meal remaining in the stomach after 4 hours, then that is a diagnosis of delayed gastric emptying for gastroparesis.
So what's the treatment for that?
So the treatment actually is multifactorial. So first of all, we have to emphasize diet. So, when we sit around the table for breakfast, we assume that our system will digest the food by the time lunch comes around and we're hungry again. People with gastroparesis, that food can be sitting in the stomach at lunch, at dinner time, and in some severe cases, even the next day.
Wow.
So adjusting your diet so that you're eating kind of smaller, more frequent meals that are lower in fat, meals that are lower in fiber is going to be really important. We do use medicines both to improve the emptying of the stomach called prokinetics, and we also use medicines called neuromodulators to tamp down the sensitivity of the stomach, as it's really uncomfortable to have all that food sitting in the stomach for a long period of time. And usually through a combination of these interventions, we can get good symptomatic improvement with most patients.
This must be a relief to come up with a diagnosis for someone who's going through something like this.
Oh, absolutely. And, a lot of patients, especially young women, a lot of times will get, waved off or sort of not taken seriously. It's just IBS or it's just, hormones or, a lot of other types of excuses. But it's really important to do the diagnostic testing and to look a second time sometimes, especially for women who are having debilitating GI symptoms.
Awesome. Doctor, thank you so much for talking with us this morning. Really appreciate it.
Thank you so much for having me.
You're welcome. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.